And welcome to the Committee of the Whole of the St. Croix County Board of Supervisors. Has everybody had a chance to sign in on the roll call? Anybody need any assistance on that? Okay. Okay, we'll take care of everybody by the end of the meeting for sure. Paul Adams, Supervisor Adams, and Jerry Van Summeren are excused, and I think we've got everybody else present. First of all, I want to welcome the supervisors and the audience to the Committee of the Whole meeting. Just because it's kind of a unique entity, a Committee of the Whole, I'll take a brief moment to explain what it is. It's in our board rules that we can have a Committee of the Whole where the Board of Supervisors can meet in a more informal way than as the board sitting as the board. And that gives us the opportunity to have full exchange of conversation, dialogue, questions, answers, and even get audience participation as is required. So it's a good way to have a more informal, friendly, neighborly discussion about key issues. And that's what we're doing today. We can act on business, and we will act on business. The only item of business before us today is what to do, hear a report on the nursing home, health campus, and possibly make a recommendation on a course of action relative to it. Let me quickly review how we're going to proceed. We'll go through some routine things, approval of the minutes. In fact, I'll do that right now. Does anybody have any amendments to the previous minutes of the Committee of the Whole? Seeing no amendments are approved. I'm going to then, as we get into it, call on our Board Chairman, Bob Long, for some introductory remarks. And then I'll be calling on Ken Witt, our County Administrator, who, together with Sandy Hackenmuller, Director of the Health Campus, and Heather Amos, our Corporate Counsel, prepared a very extensive report for today's meeting. Ken will lead the discussion on that. And, of course, it'll be open for anybody to ask any questions of Ken or Sandy or Heather during that point from the board. Following that presentation, which will cover the financial and operational issues, we'll open up the floor for discussion among the supervisors as to how we care to proceed. And then we will see if there is a course of action that we can agree on. We've gotten 3 recommendations to proceed at the back of the presentation that's been posted on the county website for the past several days, and we'll take that up. And following that, we'll have public comment. In our public comment, because we have some overflow rooms, we're going to make an extra effort to be sure that anybody who has public comment will be able to make public comment. But if we're able to resolve this during our discussion in a way satisfactory to most people that are here, there won't be a lot of need for public comment. But everybody is going to be open and welcome to make public comment and to ask questions of Administrator Witt or Sandy or Heather. And also there will be the opportunity they'll be able to answer questions you've got, so there'll be interaction between any questions and the staff and supervisors. At that point, we'll conclude things and hopefully be home for dinner. So with that, I'm going to call on our Board Chairman, Bob Long, for introductory remarks.
Thank you. 3 points of clarification, if I may. First of all, there's a small group of individuals who somehow honestly believed that myself and several others were very deceitfully working behind the scenes and already planning on selling the nursing home. I'm not quite sure how they got that information or where that came from, but I want to make it absolutely, positively crystal clear that that's absolutely false. As a matter of fact, it's absurd to think that anyone would be working behind the scenes to begin with, and let alone think that we'd actually be trying to plan on selling the nursing home. No one would ever go down that road without the specific consent of the board. So absolutely nothing has been done. We do have a slide on the presentation that does list that option, but that's it. Okay, so please don't read between the lines. Secondly, unfortunately as well, I know that there's, or at least I'm aware that there's been quite a bit of misinformation on social media. And it's really unfortunate because the end result of that misinformation has been to create a lot of negativity, a lot of fear and a lot of anxiety, particularly on behalf of our wonderful health campus employees. It's a terrible result, awful result, shameful result. So I'm not going to get into any of those specifics, but all I can ask is please do your homework before you post anything on social media. Make sure you're dealing with the accurate information and the correct data so that you're not spreading information that will lead people to incorrect conclusions. Last thing, number 3, this is just an exercise, okay, in due diligence, an exercise to educate the board on the status of our health campus. There's only 2 supervisors left on the board that were involved in the decision to build a new facility close to 10 years ago. So this is very simply, and I'll say simply because it is, we're just going to review and educate ourselves on the health campus so that we as a board can discuss if there's anything else we need to do or we want to make any changes, along with public input, which is critical. Okay, so the process is very sound. All we're going to do is educate. We're going to discuss and see if what's the best way forward. Okay, does that ring a bell with anybody? It happens to be the same process we followed when we talked about the refugee resettlement issue. All right? Very sound process. We educate, we discuss, and we decide what's the best way forward. Okay, so please, if I can just ask people to stop jumping to conclusions. Let us work through this process. It will work, and when we have the opportunity to discuss, we'll get input from the public, and I'm sure that we will come up with the appropriate way forward. Thank you.
Thank you, Chairman Long, for those remarks. Now I'll call on Administrator Witt to begin the presentation. Supervisor Leaf.
I just had a question of clarification. So we talked about having a recommendation to staff coming out of this meeting, but if there is a recommendation of staff, there would have to be a formal vote at a meeting of the whole board, correct? If there was any, depending on what the option was.
We can vote here to make a recommendation to the full board, but yes, the full board will have to vote finally on the budget.
Okay, I just wanted to make sure people understood that, because this is a different animal than a regular
Right.
board.
We still have 3 months of process in our budget process, and there will be several more opportunities for formal votes by entities of the county on it, but we'll make a recommendation before we leave here tonight.
What it would be a referral to committee. So whatever action or direction you want to give to staff, it'd be a referral to that committee to start that process. So, sorry to turn my back on the public. I just think better on my feet, so I didn't want to sit up there. Hopefully you'll be able to hear me. You can see me on the screen if you want to. But Sandy and Heather, they're going to be interjecting and interrupting me at times as I go through the presentation on anything that I forget or just comments that they want to make. But let's roll through this presentation. So we'll start off with the history of the property. So in 1897, or just before then, the city of Hudson and the city of New Richmond made a deal. The city of Hudson would get the courthouse, and New Richmond would get the insane asylum. So then began the cross-county rivalry between the two cities. So that's where the original property was. At 145 North 4th Street. It was a multi-hundred-acre property. In 1898, the county added a poorhouse, that's the terminology that they used at the time, on there, built a county farm, lots of buildings. The poorhouse building burned down in 1928 or 24. In 1958, the poor farm was closed. They stopped that practice, and several of the buildings that had been developed over the years were demolished. The nursing home complex that you're familiar with today, the first part of it was completed in 1982, and the insane asylum building, much to the dismay of many in the county, was demolished in 1984. So the healthcare campus addition was completed in 2016, and that's what we see today and are familiar with today. And additional structures just prior to that were demolished that house the Health and Human Services offices. So that's some of the history from the Wisconsin Historical Society. The referendums, they came in 2008 and 2012. The questions were really geared towards operating. So I think at that point in time, county funds were being used to cover the operating cost of the nursing home, and those were the questions that were being posed to the public. And you can see by the percentages, 2/3 of the public supported maintaining the status quo on how they were operating the nursing home. The referendums came before the construction in 2016 of the new facility. So that new facility, it cost about $20 million to build. There were 2 debt issuance payments, one in 2015 for $10 million, one in 2016 for $10 million, to make the total $20 million payments. When you do $10 million in bonds, they're bank qualified. That's why they split them up into 2 years. If you go over $10 million, they're not bank qualified, and it limits the pool of buyers, so you can generally get better interest rates if you do that. The blue bars are the principal payments, and the green bars are the interest payments. I'm just going to complain just for a second because they did this right before I started, but very heavy interest on the beginning and principal on the end. I usually try to flip things the other way. That second year they made interest-only payments. I never would have recommended that. So you'll see here that the first 9 years of payments, we've paid $4.5 million in principal and we've paid $4 million in interest. That's how come I don't recommend that type of a structure. We have $15 million left to go. We have about half the payments, but we have 3/4 of the debt still outstanding. And there's only $2 million in interest payments left. The really good thing about these debt issues is they average an interest rate of 2.3%. And the current interest rates, if we went out to borrow today, would be about 4.5%. So the 2024 payments, and I'll go back a sec, you can see that that line jumps. In 2025, there's a 54% increase in the debt payments, an extra $500,000. We're going from about $1.1 million to $1.6 million. So what that cost is on a average $400,000 house, in 2024 it's $26, in 2025 it's $40. This is just a bit misleading because there's not a $14 increase to the taxpayers. If you look at the county's total debt, it's $10.7 million per year. So the principal payment or the total payments for the nursing home of $1.1 million in 2024 are part of that $10.7 million in debt payments that the county has. In 2025, the county has $10.7 million in debt payments. But the ratio is different. 1.6 million of that 10.7 is part of the nursing home. So you'll see later on in some of the options that we have, that can actually work to our advantage. All right, so moving on to the financials. Back when they were evaluating whether to construct the addition onto the nursing home, they hired Whitfleet to do some projections. So they sort of calculated out that there would be some cash flow and that they would eventually have some income available to apply to debt service. Interesting, when I trend lined out what their projections were, it actually decreases. In reality then, comparing that, I think we can attribute a lot of this to Sandy's management of it because she does an excellent job watching the bottom line. But they've stayed positive ever since the new facility was completed in 2016. So 2016 was negative because that was a construction year, but they've been in the black every year since then. I know one of the questions was, well, how come they haven't started making debt payments yet? And the reason is, I think we're going to get to it on the next slide or two, but they were in the hole. They had a negative balance, fund balance. So they had to build their way out of the hole till they got to a point where they're financially sound enough that they can start contributing towards that. And that'll be one of the future slides here coming up. So financial data. This little box keeps getting in my way. All right, so the financial data is showing the positive cash flows. And the thing you have to understand too about the financial information is that it's an enterprise fund. It operates just like a business. The information, the data that I was showing you was their cash flow basis, so it's not taking into account accruals. When you look at the audit report and you look at the audited financial statements, you're going to see a different number because they have depreciation on there, they have WRS pension adjustments. They're accounting fictitious entries is basically what they are. They're not affecting the cash that they have in the checking account. The financial data I showed you was their actual cash flow. And cash is what you pay debt with. And so that's why I present that. Balance sheets, just like any private business, they can use depreciation and other legitimate business means to shelter their income from taxes. We don't pay taxes, so we don't really need that, but we're required to present the healthcare campus as an enterprise fund showing those same techniques that a private business would use so that they're comparable across the market to the private businesses. So the current cash flow trends do indicate, though, that the facility is now capable of contributing towards the debt service payments. It doesn't necessarily reflect soft cost. It's some of the support cost. Like all of my time presenting, preparing and presenting this PowerPoint, that's not charged to the nursing home. That's a soft cost. So. All right, so fund balance. So we talked a little bit about that they started in the hole. So 2011, I think, is probably when they stopped providing tax levy subsidy to the nursing home. I know that's when Pat Thompson was hired, and I think his philosophy was we're not going to provide that direct support anymore. So if they go in the hole, they go in the hole, and we're going to keep track of that, and eventually they should find their way out of it. And they did. I mean, it took up until 2021 before we finally got above a negative fund balance, and we've increased now the last 3 years in a row. And we've gotten above our projections. So the county board has a policy for the healthcare campus that they have 10% of their annual expenses within the fund balance, plus or minus 3%. So anywhere from 7 to 13, those are the green lines. That's our range that we're looking at. And 2023 is the first year that we've gotten above that range. So that signifies to me that now they are capable of contributing towards that debt service. So that's what that slide was telling me. So I mentioned the enterprise funds. It runs just like a business, and that's why you can show positive cash flows, but we were still negative fund balance till they finally got their way out. The accruals, depreciation, Wisconsin retirement system, so that they're comparable to private businesses. And fund balance, what it is, it's owner's equity. So assets equal liabilities. Assets minus liabilities equals capital, which is the equity, basic accounting terms. And just a reminder that debt is not on the books for the healthcare campus. Debt is on the books for the county. So the county borrowed the money, used it for the healthcare campus. The healthcare campus did not borrow the money. So that's why it's not on their books. All right, so moving on from the financials, talking a little bit about big picture of what does the nursing home market and industry look like in St. Croix County. These are all of the facilities that are available in St. Croix County along with their capacities. If you look at where they're spread out around the county, you know, they're kind of evenly distributed along the major corridors and population centers. So we have unless you need to interrupt me now, Sandy. All right, so we have 412 nursing home beds in the county at 8 different facilities. So I took this information from the Wisconsin Department of Health Services, the annual reports that they file. So it's a snapshot in time, but at the time of those individual audits, the average occupancy was 66%. St. Croix County has 50 beds, 12% of the total, and our occupancy at the time of our audit was 66%, so we were right on average. Community-based residential facilities, there's 455 CBRF beds in the county at 17 different facilities. Now beds are at different levels. So if you looked at the beds that would take frail and elderly, there's only 14 facilities, 421 beds. And if you look at how many would take family care, there was only 9 facilities, 289 beds.
And of the 289 beds, You really cannot fill your whole facility with the family care rate because it's so low that you financially couldn't maintain your facility. So when we're talking about 289 in 9 facilities, probably 50% of them would be available for family care, which is community Medicaid. Okay? Any questions?
I'm sure there'll be questions. All right. So the average occupancy at the time of audit out of all the facilities was about 75%. St. Croix County has 58 beds. We make up about 13% of the total beds in the county. And our average occupancy was 55%. But Kitty Road's 10 beds has been empty the last couple of years. It was empty at the time of that audit, which probably affects that.
For those that might not know, could you give us a little bit of what a nursing home is and what the community-based residential facilities are?
A nursing home requires a person to have skilled care, so there's around-the-clock licensed nurses involved, RNs and LPNs, and nursing assistants. Assisted living is personal care assistants that has special training, or nursing assistants that have special training, but there's not RNs around the clock or nurses around the clock. It's a lower level of care. There is a nurse that's on call 24 hours, 7 days a week, but they're only on call. So that's the difference in the 2 facilities. So if you think of a CBRF as apartment with services.
All right. There's also a website that I found when I was doing this research. Actually, the county board chair found it and referred me to it. But it's Medicare.gov. You can compare all the different facilities. They have a lot of good information out there. So I added it to the slides. You can go out and take a look at it. Supervisor Rice?
Yes, I'm just curious, and tell me if I should hold on this. My understanding is that some of the residents of our county nursing home are under guardianship. Do we have any idea of the head count for the number that are under guardianship?
There's 2 different ways that a resident can enter into a nursing home or assisted living. And our memory care does require they're activated, which means they have to be activated with a healthcare power of attorney or financial power of attorney, hence why they're in Medicare or memory care. And in a nursing home, we can't admit anybody that needs a guardian or that can't sign themselves in by law unless they have a guardian or a healthcare power of attorney for finance or sign. They have to be, 2 physicians have to sign that they're unable to make those decisions.
So the reason I'm curious about the number is my understanding is even in the unlikely future scenario where the county decides we're not going to run this anymore, that we continue to bear the expense of any resident that is under guardianship.
Mm-hmm.
So my office does handle the guardianship and protective placement cases, and in most cases, there is some funding source that the individual has that pays for their care. It's very rare that the individual doesn't have a funding source, whether that be Medicare, Medicaid, family care. There is a small portion of the population that it may take longer for them to get that funding, and the county may be responsible for that, but that's regardless whether we have a county nursing home or not. It doesn't matter where they're placed, we may still be responsible for their care depending if they have a funding source or not. So for example, someone that's 18 or 19 years old, maybe their diagnosis doesn't meet the criteria for them to qualify for Social Security disability. They haven't had enough earning quarterly credits to qualify for SSI, so they have no funding source. The county may be responsible for their care at any facility until they get qualified for a funding source. So hopefully that answered your question.
Well, before we go forward, I'd just like to know a head count, a number. Sorry to use that kind of crass language, but how many people?
I will try to get that number while Administrator Witt is finishing up the presentation.
Tough questions today, huh? Supervisor Rice? All right. Yeah. All right, they're only getting started, they said. Okay, so Medicaid versus private pay. There was a report, I know it's a little dated, it was the best information that I could find. It's from 2019. MacPac, they made this report to the federal government, to Congress, and basically what it showed was that 59% of residents at nursing home facilities, Medicaid was their primary payer. So I don't know if they took into consideration, if you look at our ratio, we're 44%, but I don't know if they looked at just Medicaid and private pay, because Medicare, when we have a Medicare patient, that's somebody that's really in there for a rehab. They had hip surgery, they can't take care of themselves, nobody at home can take care of them in their current condition. They're going to be there for a couple of months. They rehab, Medicare is paying for that, and then they're able to go home after that. Medicaid is, they're going to be there long term. There's no recovery solution really planned for it. So I don't know in the federal report if they took that into consideration. If you looked at our ratio of just Medicaid and private pay and you crossed off the Medicare, we would be right at that 59, I think it comes out to 57%. So we're very average in comparison, really, if you take a look at it in a couple of different ways. But our ratios, our current mix anyways is 44% Medicaid, 34% private pay, and we're averaging 22% Medicare. All right, so our current pricing structure, our private pays are at $320 a day. The state average is $345, so we're pretty close in line where the state average is. Medicaid rates, they're based on the care of the resident needs, so this will change. That ratio can go up or down, or that dollar amount. Our Q1 average, though, was $479, and this is up significantly higher than what it was last year. So this is the big change that's occurred. This is pretty much doubled, I think, Sandy, from what we were making last year. Because it used to always be, well, we want private pays because they pay more. Well, actually, private pay is the lowest rate right now. So we want Medicare because they have the highest rate, although they do have a higher service level too. So maybe the net profit on those is not as good. The Medicare rate, though, is quite frankly the most profitable rate that we have at the facility right now. And private pay at $320 is the lowest. Now, that's just on the skilled nursing beds. In Orchard View, the assisted living CBRF, our private pay is $190, the Medicaid rate is $112. And in Kitty Roads, we have a budgeted rate. We're not currently charging anyone there, but they would be at $650 for either private pay or for family care.
The Medicaid rate is based on a resident's care needs, and there's a large assessment that's done that comes up with a number or letter that determines what the rates are. So that's why it's so variable. And the Medicare rate is, like I explained to Ken, it's an all-inclusive vacation. So we get one rate based on their assessment, and we pay for their medications, their therapy. So we pay for all of those items.
So that Medicare rate, while it's a higher daily rate, they also have a higher service level. So there's more expenses going into that rate.
Yep.
Supervisor Leaf?
So when did the Medicaid payment increase happen? The percentage
Increase or decrease?
increase?
Increase. Right now, we have our interim rates for this year, and their interim rates, then in October, as soon as they've reviewed everybody's cost report and signed off on it, then we'll get our final rates.
Okay. But it's a lot better. The percentage that you're getting is based on the
Yes.
care. So that is the change, and that can affect
Yes.
how the revenue looks from previous years to this one.
Absolutely. Up to last year, Medicaid we were 48th in the United States with the worst Medicaid rate, and that was increased by the state. And now, instead of us having to go and ask for an increase every year, it's set up on an automatic increase like most things are in the budget.
You know, Sandy, what the average Medicaid rate last year was? It was about half, it was about half the current rate.
Yes, yes.
Yeah. So when you look at the profitability of the healthcare campus facility, and 44% of our beds were at the Medicaid rate, it was half of what it is right now. So when we're putting together the 2025 budget, the numbers look a lot better because we have a higher daily rate from Medicaid, so that portion of the budget has changed, so the revenues are a lot higher.
I have an answer for Supervisor Rice. I believe, so the county, I believe we have approximately 85 people under protective placement right now, and 5 of those individuals are at the healthcare campus. And the 85 is an approximate, it's somewhere between 80 and 90, but I don't remember the exact number.
All right. St. Croix County population served, one of the questions were, where do the people come from? And while most admissions do come from, you know, the Roberts, Star Prairie, Somerset, New Richmond, Deer Park area, we do have admissions from other parts of the county. But, you know, if you looked at where most of them are coming from, people use a facility that's close to family, generally is how it's determined. And so people either live there or family lives there, and they're bringing them to our facility. If you look at our numbers, so this is a map showing where our residents come from throughout the county. So you can see New Richmond is predominantly where they do come from, but again, it's spread out across the county.
And if you're confused about the little red things on the side, those are actually different states. And it was, we brought people from Georgia, North Dakota, South Dakota, because their family lives in St. Croix County. So they could be near their family.
All right. So let's talk about what the options are, and these are the options I thought of. I mean, maybe there's more, but you can always do nothing, status quo. That's the easiest one. So things are profitable right now. You don't have to change anything. Option B then is keeping the facility, but implementing some new strategies. And I think we're already starting to work on this first bullet point of opening the Kitty Rhodes Memorial Care Unit. We have received a grant from the state to assist with some of the startup cost to get that 10-bed unit back up and running. It'll help with workforce incentives to hire the staff, because that's really been our biggest barrier to opening that part, is having enough CNAs to staff it. The other thing we could do is we could require the healthcare campus to start making $500,000 fund balance transfers that would go to the debt service fund starting in 2025. This will actually negate that increase in the debt payment costs, and the net result is actually a $14 decrease for the taxpayers. Because remember, the debt is $10.7 million that the county is going to pay last year and next year. So if $500,000 comes from a different revenue source, we'll only levy $10.2 million for our debt payments. So that actually is a $14 decrease for the taxpayers. And based upon the financial analysis and where the fund balance has just reached, that would have been my recommendation as we go into the 2025 budget, that we're capable of doing that at this point. And then again, I would reevaluate this every 2 to 3 years to see where the Medicaid rates are affecting the healthcare campus. Maybe that debt payment can go up in future years if it's as profitable as we're projecting it to be right now. And one of the options that we have is the healthcare campus is not mandated. It does compete with private industry, and I know that does bother people. So the county board always has the ability to sell the facility. I was talking with John Kryzik, who was the administrative coordinator back in the 90s, and he said in 1990, the county board had a buyer for the nursing home, and they were going to sell it, and something happened with that deal, and it fell through. In 1996, they were going to sell the facility again, and it failed by 1 vote. 2008, they went to referendum asking the voters about the nursing home. 2012, they went to voters asking about the nursing home. And here we are in 2024, again talking about the nursing home. So yes, the county board always has that option. If that is something that you want to do, the first step would really be to evaluate what the value of the facility is and compare that to what we have for outstanding debt, so you can make an informed decision if that's a good financial endeavor for the county to take on. The proceeds could be used to reduce other borrowing costs. It wouldn't necessarily be applied to that debt service, but it would avoid other borrowings. And just to point out, Sauk County, when they were looking at selling their facility this year, one of the clauses they put in was that the beds could not leave the county. I know that was one of the huge concerns. So if you decided that's what you want to do, you could write in different rules, different restrictions on any buyer to make sure those things are preserved. All right, so here's where we open it up for county board questions.
Can I just jump in for 1 second and clarify one thing on option B, which frankly, in my judgment, seems to be a very good option. The grant we got, was that about just under $500,000 to get us started on that?
Yeah, I think we're looking at least $450,000 in that grant.
Okay, so if we were to do something like that, we've got a grant to get it started. We could open Kitty Roads. That opens up 10 dementia beds. Gets money in. And the net result, you phrased it a little bit differently, but I'll phrase it as a $500,000 tax cut for the citizens of St. Croix County. Is that correct?
Correct.
Okay. Supervisor Artino.
Thank you, Mr. Chair.
And by the way, if the questions are directed to Ken or Sandy or Heather,
yeah.
please direct them directly to them. You don't have to go through me. We'll just make it directly to them.
Thank you.
And after that, we'll have Supervisor Leaf.
Thank you. My question would be for our Administrator Witt, and it was the very similar line, the Kitty Roads Memorial Memory Care Unit. We have struggled with that for, what, 3+ years now, that we were either couldn't staff it, couldn't afford it. We had some difficulty with some kind of, there was always an issue. My question is, if we get the state to give us that $500,000, how much is it going to cost the county on top of that to get that open, up and running?
Yep. So so 3 years ago, COVID hit, and that was really the deciding factor of why we ended up shutting it down. We still have some dementia patients at our facility. They're on the 2nd floor of Orchard View. But really, that type of patient and masking requirements that the facility was required to have was a difficulty. And so we transitioned the patients to other areas, and we sort of closed that wing down. And then staffing shortages. Not just in this position, really lots of different hiring positions, and not just the county, all over. Employers are having trouble hiring people. And so we couldn't staff up enough to open that wing back up. It'll take 10 CNAs, additional CNAs, to open that up. So those are the challenges that led to that. When we open that facility up, and ignore for a minute the grant that we have, when we open that facility up and we look at the operating cost, filling the beds for the cost of the 10 CNAs and other staff that we'll have that support it, we project that that wing will have a net profit of about $250,000 per year. So
Thank you very much.
Yeah.
You answered my question.
Yeah.
I know we've had struggles with that going forward, in the past. So the one thing about that is if we have hard time getting staff, how are we going to get staffing if they, A, don't exist, or B, don't want to work for the county? I'm not, that $500,000, is it going to work?
Well, we're going to throw money at them. That's how we're going to get them. So that's part of what that $450,000 is for. It's for hiring incentives. And so hopefully, if we have enough money, we'll be able to find the people to come and start working for our facility. So, I mean, we're doing other things in addition to that, but we're hopeful that we're going to find the staff and we'll be able to retain the staff and keep that facility running.
The grant actually we were lucky enough, we actually asked, and I don't know if Bob is here or Shar, but they did the grant and they had asked for 350 or 375,000. And because of the people that applied, there were 2 facilities that could get up and running right away, and we were one of them, so they increased the amount to 450,000. It's important that this happens, because this is filling a need, and it can fill the need regionally, which will help us with revenue. And there are incentives for staff recruiting and retention included in that 500.
And the other key thing is we have to spend the money by March 2024. So this is going to be a fast track process, or 2025, sorry, by March 2025. Yeah.
I threw you on the spot, but I was going to have you explain what was like the fast track of this grant and how it just sort of was, it came to fruition and it was very quick.
Just for our audience, this is Bob Rohrt at the podium. He's the director of HHS.
Yeah, so I'm sorry if I missed a little bit of that coming over here. So these are ARPA funds that were offered through a grant that, as you said, have to be spent by the end of March of next year. Initially, and Char Lopez did a lot of the work on this grant, our deputy director, along with Sandy and her team. But the original award amount was $340,000, $373,000 that we received. And then we got an additional $70,000 from the state saying, here's some additional money for you to open this place up. Yesterday we found out that we received an additional $300,000 due to another facility not being able to follow through with their grant obligations. So in total we have, what is that? About $750,000 for startup funds. It's like Shar said, it's the grant that keeps on giving. So the issue now is how to devise a budget around that for things that we need that could help the facility open.
And can you explain what type of patient you're going to be seeing there too? Because it's a little different, and that's part of the filling the need around the region bit.
So the name of this type of service is Dementia Crisis Stabilization Unit, DCSU. It's a specific. Well, it's a not yet well-defined level of care, but it'll be a shorter term length of stay, 28 days, for people that come in there. And then the idea is at the moment of admission, to start discharge planning, that is finding longer term or other suitable outcome for that person beyond that 28 days of stabilization. So the idea is obviously to stabilize and treat folks and find a place for them to go longer term if they need that, or back to the situation they came from if that's safe. Does that help? All right. Thank you.
So some of these are harder to place individuals. So that's one of the challenges that we've run into, and we've ended up sending people to Clark County or other facilities because we didn't have the right classification to put them. So this facility is going to serve not only our needs, but it's going to serve other surrounding counties. So they can stabilize those patients, and they may send them back to the other facilities, or we may have a space for them within our own facility then once they're stabilized.
Supervisor Ramberg.
Thank you. Do we have a consciousness of the waiting lists of all of the facilities in the county, being a baby boomer myself, and the expansion of that need moving forward?
I think there'll be a bed available for you, Supervisor Ramberg. If we looked at the statistics, though, the occupancy was only 66%. So that's the average occupancy rate. So there should be plenty of beds available right now.
Actually, we only have 3 units left in Orchard View.
Okay.
We've been busy.
You better get your reservation.
Supervisor Rice.
Yeah, I'd like to speak to option B and the notion of reevaluating in a couple of years. I think one of the challenges we've got right now is the residents of this county, they know the risk involved. I personally am not opposed to outsourcing to private sector, to hiring private sector to do what they do well. There is no evidence the private sector does this well. I've had relatives who have worked in nursing homes, and private equity firms are coming in and gobbling up these organizations. I'm not talking about county-owned specific, but they're consolidating, and what happens is your staff gets double the workload, and the care goes down, and the family members are stressed about it. And additionally, we have county workers who work there, their family members who are residents there, and what they find is that we're every couple of years bringing this issue out, dusting it off, you know, whether it's social media or some other thing, people are filling in the blanks. They get worried and nervous about what we might or might not decide. And I'm not aware of any other department that we do here in the county where we put them under the microscope like this. I mean, there's probably every division or every department here that could use a little bit of tweak from now and then. But no, please don't applaud. This is my opinion, this is my point of view, but the more I look at the for-profit sector for nursing homes, it is just not a business model that anyone would want to put a loved one in. They wouldn't. In some states, that's all you've got, but here in this county, we have an asset, and we should look at it that way. So I would like to see us push this out, not every 2 to 3 years, but more like 5 years, just so that people are not stressing about it.
And I think what I mean by reevaluating 2 to 3 years is the Medicaid rate is a new change this year in 2024. So we don't know what that financial statement's going to look like at the end of 24 and the end of 25. And the $500,000 is an arbitrary throw a dart at the board, say we're going to start with that. So that number may change. That number may be able to go up. So we need to reevaluate where the profitability is and what their capacity is to make contributions toward the debt service payments.
Right, and this is such a complex area that I don't know that there are many experts in the room, but even things like lowering the price of drugs like my mother takes, Eliquis, I mean, all of that is going to have a ripple effect on profit and loss, so.
In an effort to kind of move things along and try to get the sense of the room, maybe I could just suggest at this point, since there's been no comment on A and C, I would just suggest, is there any objection to taking options A and C off the table at this point and focusing any further comments on option B? Seeing no objection, any further comments, we'll focus on option B. Are there any further comments? Supervisor Long.
First of all, I think probably why this comes under the microscope more often than we'd like is it is a non-mandated service and a fairly expensive one. So probably, correct me if I'm wrong, Ken, probably 80–90% of the services we provide in the county are mandated by the state. So there's not a lot we can really do. We don't have a lot of flexibility. This happens to be one that we are not required to provide, and it's a fair amount of money, so it's an area that we might have some flexibility on. So that's probably the reason that it comes up more often than we'd like. And I just want to, I'm also in favor of this option B, but in all fairness to the for-profit and nonprofit nursing homes, there are some excellent facilities. And I don't want to diss them just because we think we're better. Okay, so, and if you look at the Medicare.gov comparisons, you know, they're right up there with us. So some may give better care, some may not, but I don't think it's fair to assume that the privatized nursing homes are far worse.
Supervisor Osnes, followed by Supervisor Carlson.
Thank you, Mr. Chair. I'd just like to let the county board members know and staff members know that while sitting on committees at state level, and I serve on a committee at the national level, the one thing that I've heard at both levels, which put a very big smile on my face, was the Health and the Rehab Center in Richmond, and what a fantastic operation that you have in St. Croix County and the tremendous staff that makes that work. And I think that's great that facility is being recognized down in Madison, and they are being recognized in Washington, D.C., and that says a great deal for Sandy, you, and your entire staff. So thank you for all your good work.
And one quick question. Total of soft costs. You mentioned soft costs, just ballpark. soft cost to the county.
Yeah, I think you're talking tens of thousands of dollars.
So if I was on the board and at the time when it was being considered to open, I would have been 100% against it because it's competing against, but that's passed. I would not be for closing this unless I knew all the patients were in as well or a better place. We would have to have a really good plan, and I would have to, and I don't know if we could even do that. So, because we need to take care of them. We took on the obligation already. So I wouldn't be for closing it down unless a really, really good plan is proposed.
Supervisor Telejohn.
Are we mandated to have a jail,
Yes.
Yes.
or can we privatize that?
No, we're mandated to have it. We're mandated to have it within the city limits of Hudson.
So are we going to look at anything else that's not mandated? I mean, Bob raised the question.
Well, the examples I've heard of non-mandated services are things like human resources, IT, facilities, some of the basic things that we need to run the county. So we just don't have a lot of flexibility in terms of discretionary services.
Supervisor Running.
Thank you, Mr. Chair. So I had a question on our private pay rates. What is the historic trend of our private pay rates over the last decade, and where do you think that's going to go? Well, let's start with that.
We try to stay equal with other people around the area. And I put in, we have to have the rates approved by the HHS board, which I actually asked for a 10% increase. No, 5% increase. Ken thinks I should do 10.
I recommend 10.
Okay, well, the reason I ask, now that Medicaid reimbursement rates have been increased, and the whole point of wanting private pay was because it's more, the fact that we also deliver a higher quality product, and I do believe that. I had a family member that was there over the last years of her life, and I do believe that there is a higher quality product, which I believe that we should be charging a higher rate than just your average competitor. And that also means that we will be able to help offset the debt service and other services that are provided by the taxpayers for the facility that you operate, because it's a complete disadvantage to private, whether they're nonprofit or for-profit homes. Look at IT costs, right? I mean, they have to have staff that they pay, either if it's a 20 location facility or a 1 location facility. They have to have somebody come in and make sure laptops are secure, they're working, emails working, all of that. Okay, so I'm going to take my time to go through these because I think it's important. So I think I would encourage, I'm not telling because I can't, there's 19 of us, I would encourage that we look at a higher private pay taxing or private pay increase to offset the superior product that we have. I think it's only right, and I think people want to pay for value, and I think that's a good way to go. So that's why I wanted to go down that path really quick. So talk to me about these out-of-state residents that you took in. So were those mostly private pay?
I couldn't tell you the private or the source rate. I know that the one we recently took was Medicare, and I don't know what her pay source is now.
I would say about half and half. If they come in,
Sure.
Half and half is what she's saying.
We probably need to have you come up to the microphone. This is Lisa. She's my, she does our billing at our facility, and she would have her finger on the pulse to that.
Oh, by the way, I don't envy you doing medical billing.
do any of the billing. I would say, out of those people, they either came in on Medicare A or private pay, or they didn't have a payer source, and once they became our resident, they became a Wisconsin resident, we could get them on Medicaid. So it was about half and half. And when you say with the private pay rates, a lot of those people in, I don't know, 5 to 10 years are going to run out of funds. And I've been working with them to get them on medical assistance. So a lot of the ones on medical assistance started with at self-pay rate.
Yep. Yeah, totally understood, but I'm just also making a point that if we're subsidizing a building and maintenance and IT and HR and I mean, I don't know what else, right? But then we're delivering a superior product to competitors around the county. I think it's only right that the consumer, whoever that is, pays a higher rate for that higher quality product. That's, I'm not cheap, but.
I will tell you that we do bill or get billed for every maintenance hour worked in our building, but we don't pay for Taylor's 100% of his working or Sandy Stanger. And so I think you think it's more than it is.
Well, but even still, even if it's $1.5 million in a brand new facility, I know that a lot of the facilities around the county don't have a brand new state-of-the-art facility that someone paid $20 million for, plus interest. So that's my main point. And I understand that, but
All right.
yes. Okay, so thank you for that. That answered my question.
I just have a question for Sandy on the private pay. Can we only increase it so much a year, or is there a cap of how much we can increase it?
No, we can increase it as much as we want, but we have to bring it to the HHS board to approve our rates. So,
Supervisor Hanson.
Oh, I'm sorry, I have a list.
Oh, okay. Supervisor Hanson.
Thank you. Okay, so, sorry, I was scribbling all over. I have bad handwriting. I can't even read my own writing. The debts, okay, so I brought that up. Yeah, THR, building maintenance. Liability insurance, who pays that for the building and other things? So can you touch on that, please?
Yeah, we give a prorated charge to the healthcare campus for the insurances.
Okay, cool. And then if we open Kitty Roads, you answered the question, approximately $250,000 of gross margin on that. How did we come to that conclusion? Can you explain that, please?
Yep, so it's the number of beds times the projected number that we would fill over the year times the daily rate, minus the staffing costs for that, revenues minus expenses, net of 250. Sandy puts all of that together, her and her team, and she does a wonderful job delivering, so I'm fairly confident in that.
Supervisor Hanson. Followed by.
I wanted to just ask about the private pay pricing. Do you consider what the market is, what all the other facilities are charging, and price yourself according to the market?
yes, that's what we generally do every year for the private pay rate.
Supervisor Shirley.
Yeah, just thank you, Ryan. And then how do you try to place the facility? Are you trying to be right in the middle, or are you trying to place yourself, because like Paul said, the quality of care,
Pretty
Supervisor
equal
Burning.
to where the most people are. 'Cause
Right,
there's
quality of
usually
care is
outliers.
excellent.
There's
so-
usually a couple outliers to the rate.
Right, so we want to be on the upper side of, okay, good.
Upper side, more like 10%.
10% according to Ken, yeah.
There we go. All right, a couple comments I want to make. First of all, I think I agree with Supervisor Long that it's brought up because it's a non-mandated service. The other thing is, it's an enterprise fund. So it's separate from the rest of our county budget, in that they have their own budget and everything else. So we should be scrutinizing it more than others. So one thing that I would like to see, since it is an enterprise fund, is that I think that they should be fully reimbursed, or the county should be fully reimbursed for HR time, IT time, and facilities time. If they are going to run their own budgets, their own any of that a normal business would, then why shouldn't they bear the costs like any other business would? So I think we need to really look at what those numbers are, and I would like to see that portion of what we talk about today get referred back to the admin committee to come up with what those actual dollar amounts are, because I think they're higher than tens of thousands of dollars. I think they're much higher than that. But I would also like to see that, I agree with Supervisor Burning that our debt service payments, I think, need to start a little bit higher than the 500. You know, if we review that in a year from now, or whatnot, if we want to look at that portion of it, I think that that's an important thing to do. $1.5 million as a debt service payment that's not on the enterprise books is a big deal. And I think that, you know, as we're looking at all of these other things that are on our capital improvement projects that are coming up, you know, we're going to tax ourselves out. We're looking at a highway department building that, if I run my math right, I may be 25 cents off. Ken, you'll tell me. $5.50 per 100,000 in assessed or equalized value, I think, is roughly where we are. Maybe 525, somewhere in there. So our highway department building is going to cost us an average $400,000 house in Hudson, $157 additional every year. So we start tacking those little things on here and here and here and here. I'm already hearing from people in the Richmond area that we're taxing them out of their home. And we can't continue to do this. So if we can find ways like this, and I love this exercise that we can go through things and really talk about them and scrutinize where we can move funds around so that we're not doing that. So I think that's the, you have to step back and look at it as a bigger picture than just, we run this great facility and it needs to be here. It's so much more encompassing than that. And it's so much more complex than that, there's a lot that goes into how we decide to move forward in this.
I'm going to call on Supervisor Leaf and then Supervisor, and then, but just a quick comment, Ken, if you could, because I think Supervisor Shirley makes a good point about the tax burden on people. But could you very quickly explain, when people get their tax bill in January, what percentage of that roughly is for county expenditures as opposed to school boards, community colleges, et cetera?
Out of the total tax bill, the average is about 20% of it is for the county services. The largest portion of your property tax bill is from school districts. They generally range anywhere from 50 to upwards of 60% of your tax bill.
Supervisor Lee.
What other enterprise funds are there in the county?
Highway.
So if we're going to do this to the healthcare campus in terms of reimbursement, would that also apply to them, is my question.
Supervisor Barkalow.
Thank you. I'm sorry, your first name? Sandy, thank you, sorry. Have we looked at any generational studies as far as like the average baby boomers in their 70s, I would guess, right? Early late 60s?
I've been doing this so long, age means, I have to tell you, age means nothing to me, because I've been doing it since I was 16, which is a long time ago, but
what I'm trying to say is that generation is 60 million people.
Mm-hmm.
The generation behind it is only 20 million people, and you will probably see a decrease in use. In the next 15 to 20 years, I think we theoretically see a decline in usage of that.
Actually, we did plan for that because we built the healthcare campus so that it could be assisted living or it could be skilled nursing. We purposely did that when we built it. So it could be converted into apartments with services.
Okay, and then profitability, has that been studied at all? Have you studied any profitability for that use?
No, I haven't looked at that, but for the future, we haven't done that since Whiffley study.
Okay. My other question was, if we are discussing a payback system where they pay us back $500,000 a year, what if we do a slow cutoff where it becomes its own entity, still funded or facilitated by the county, but it is over time becoming its own I don't know what you want to call it, but a public-private entity over the next possibly 20 or 30 years.
So what I would recommend is we have 11 years of debt payments. So, continue to have the facility contribute towards those debt payments. But the question is, what do you do with the net profit from the facility after the debt payments are gone? As an enterprise fund, you can do whatever you want with it. You control it. So you can use that for taxpayer relief after the debt payments are gone. So if it still maintains profitability 12 years out, you can just be using that to reduce debt costs or total taxpayer burden. So, I mean, it is split out already. We keep the books separately. And there is some merging. That's where some of those soft costs get lost. There's some merging of that. And we can probably do a better job of identifying those costs and charging them to the facility. But they are separated already.
Okay. That was kind of, if it's $500,000 a year, that would be to pay back the $20 million to build the building. It was over 30 years. So I was just kind of thinking long term.
Yeah, well, I believe that this number can go up. I'm starting conservatively with the 500,000 because I know they can carry that. But I mean, that number might be $1 million. And we can take another look at it when we're putting the 2026 budget together. But we'll definitely reevaluate that. I just need to see the financial details that support that rather than me guessing based upon 8 months of data and projecting out.
I think we've had a full and open discussion. If there's any more questions, surely we'll entertain them. But if not, remember, our purpose is now to give guidance to the administrator to make his presentation into the administration committee in mid-September as to more specifics about this and to take into consideration all the remarks that have been made by supervisors tonight. Is that correct?
Yeah, I think, we're in the process right now of putting together the 2025 budget. And if these are the things that you want to see in the 2025 budget, I got like 2 weeks left to get this done. So I'm gathering that information. I'm gathering your input tonight. And I think you've narrowed it down to option B here. So I will build these things into the 2025 budget and then taking some of your other comments and working on those, seeing what I can build into the 25 budget over the next few weeks. And present that to you at the October Committee of the Whole meeting when we go over the budget.
I'll call on the two supervisors. Otherwise, I was going to call if there was a consensus around what the administrator just said, we could take a position on that. But I'll call on the two supervisors first. First, Osnes, and Tino, and then Osnes.
Thank you. Two things here. I believe I will support option B here with a reevaluation on a yearly basis because the rates change, the budgets change, everything is up to flux. The amount of people from one year to the other that are using this. And I guess I have one concern that it's my opinion that the county does not need to be in the nursing home business. And here's what I'm looking at right now. Most admissions are from the following locations, and if you go back to that map, it looks to me like New Richmond and the surrounding area there pretty much has a private nursing home to use. Very little bit of the rest of that county is actually utilizing that. And the number one criteria when a family member looks at a nursing home for another family member is location. And location is because they want to be able to go and visit. They want to be able to go and see their relative. I hope my wife doesn't send me to New Richmond because I won't get anybody to come and see me. I'm not sure we're servicing the entire county, and that's my concern. Thank you very much.
Supervisor Osnes, and then Supervisor Shirley.
Correct me if I'm wrong then, Mr. Chair. We are looking at option B, correct? As as written. Okay.
Your mic, Supervisor Fiedler.
Yes, you're correct, and as enunciated by the administrator a moment ago. And we're just giving guidance that that's how we would follow it, if that's what we do in just a moment. Supervisor Shirley.
One other item that came up tonight, kind of aligned with this, is the reopening of Kitty Roads. I think that fast track project, now that we have that grant, we just found out that it was awarded on the 16th, I think it was. I would like to see that referred to the admin committee for HR and IT and all those startup costs to come up with a strategy of what we're actually going to use that money for. Because that streamlined cost, there's issues with trying to figure out what we're going to do with that money that's really going to be tangible, really going to work, and keep us profitable in that section in the future. So I think that we really need to get a jump on it. We need to have a strategy come up very quickly if we're going to move forward.
It'd be the
Supervisor Burton.
HHS board, that would be the jurisdiction of committee for that, and they have been briefed on the grant.
But most of the strategy from what we heard tonight was HR and how we were going to try to find people that we couldn't find before to staff this. So I don't know. I agree that yes, it needs to go through HHS, but I think HR and how the admin around that is the key strategy point.
There are some components that are coming to admin related to it, but not the grant overall.
Administrator Witt, can I just speak to that point for a second? So the application that was submitted to the Department of Health Services breaks down like the cost for almost everything: unit clocks, restroom supplies, outdoor patio furniture, medical supplies. And so it's already pretty detailed about what each section of the grant will pay for, because obviously then it needs to be reported back to the state how those monies were spent. There is obviously some for incentives for getting employees on board, but it is pretty already detailed out in the grant document what each, and now we got more money, but it's pretty detailed out in the grant application.
And the HHS board has seen this once, if not twice already.
Yes, thank you, Corporation Counsel.
Okay, with that, if Supervisor Counter.
Thank you. Just two things. One, we've been talking a lot tonight on the soft cost, and if I understood you correctly, you said that soft costs are running around $10,000 a year total?
Tens of thousands. So I don't know if
Tens
it's
of
10 or
thousands?
20 or if it's 40, but I mean, it's probably not in the hundreds of thousands. I would guess that it's under 100. So it's in the tens, but
Tens
it's
of
soft
thousands.
costs, so we're not measuring it. And it's hard to, this meeting tonight, the cost to pay the supervisors to come here, this is the only agenda topic. So this is a soft cost. Do you charge this to the healthcare campus? I mean, that's what a soft cost is.
Okay. It's just, there's some of the other members on the board have concerns over what those soft costs are and what the totals are. So if we don't, if it's all over the board, it's difficult. Well, is this a real big number or a little number, or where do we stand and how does it impact us? So I just want to make sure that, if it's, originally you were mentioning it wasn't worth tracking before, that's why I'm asking the question.
Yeah. Part of it is the healthcare campus couldn't afford it. They were in the hole to begin with. So we weren't charging them a whole bunch of extra cost. If HR was doing recruitments, they just do the recruitments and add them in with the recruitments they do. We weren't charging them for that HR time. Now that they're more profitable, maybe we take a closer look at that and we say, okay, well, we're going to charge 10% of this staff person to the healthcare campus, and we start increasing those. We already have some of those. Facilities is really great about that. But we also charge some of finance already back and have for many years. Charge some of them back for processing of payroll and paying of bills. So we do charge some of the costs back. I'm just saying there's additional ones out there with IT and my time and with HR that we haven't been, that we could take a look at and charge more.
Okay. The other thing was on page 13 of your presentation, I was looking at the graph, and one of the things, one of the impacts I was looking at was during one of the low periods there seemed like there was an impact from COVID. Would that have a relation in there of why we were sitting at a much lower number during a certain period there?
Yeah, and the fund balance is reflective of the full accrual accounting. And so that doesn't necessarily correlate directly every year with cash flow. And so there's not a direct correlation. If you look at these and go, well, look at the cash flow, well, those numbers don't match. Well, because this accounts for all of the numbers hitting the books, and the cash flow numbers that we went over on the previous slide to this did not look at depreciation and some other accrual entries. So yes and no. COVID definitely did have an impact on the bottom line, but there's some other things going on there also.
Are there any other questions or observations from the supervisors? Seeing none, as we were a moment ago, can we get a consensus that we'll agree to, that the administrator will formulate a recommendation to the administration committee focused around what is embraced by recommendation B and augmented by our conversations this evening? I'll just ask for an A and nay on that. All those in favor say aye.
Aye.
Those opposed? The ayes have it. Thank you. Is that sufficient for you, Mr. Administrator?
Yep.
Okay, great. That concludes our business portion of the meeting. We'll now have public comment. And so I would just remind the public now at this point, we've unanimously recommended that there will not be a sale of the public health campus. And we will be pursuing these other things which have tremendous advantages of opening up the dementia unit. And we're doing very well financially. So with that, I'll ask the people, and we have runners in the other rooms. If there are anybody who wants to make a comment in those rooms, we'll give them time to come to this room to make them. But I would just ask if there's anybody here, but I would want to limit the comment to people that are residents of St. Croix County today. So is there any other public comment from residents of St. Croix County today? Please come to the podium and state your name, and that would be great. And remember, we're trying to keep things to the point, but feel free, we're not trying to cut you off, but get right to the point, please. Thank you.
Thank you very much. I appreciate your making the decision you've made today. I'm disappointed that you haven't made a longer-term commitment. I just want to comment on some things that were very disappointing to hear from some of the supervisors. By the way, my name is Celeste Cobrel. I live in the town of Hudson. I've had a home there for 31 years. Over that 31 years, I've paid a lot of property taxes. And you know what? My property taxes have gone for lots of stuff I've gotten absolutely no benefit from. Maybe we should look at selling off that. What's the other enterprise fund? Why, it's your highways. I've never driven on most of the roads the county that has paid to build in this community. So why don't you look at selling off those too? I'm really pretty much taken aback, specifically by your comments, Mr. Burning, about how we should try and milk the elderly to drive them into poverty faster so they end up on Medicaid sooner if they're in our nursing home so you can get more money. Burning. So thank you very much.
Let me interrupt for a second.
That's totally inappropriate, please.
We don't make personal comments during our public comment.
You made personal comments about the elderly. I'm just referencing specifically something that Mr. Burning said and that my public comment is regarding. Thank you, Supervisor Long.
It's still not appropriate. Thank you.
Okay, next public comment, please. And I'll introduce this person, former Supervisor Ard.
Good evening, everyone, supervisors, Mr. Chairman, and the public who is here. The nursing home has been around slightly less than my family. We've been here that long. And we've all worked with the nursing home from the point that it was an asylum right up to today. But this is what I'm going to tell you. A supervisor asked a question earlier. What is the wait list in St. Croix County for, let's say, skilled nursing? What am I thinking? Oh, my God. You'll have to forgive me. I've been running since 5 this morning, and it's been hectic. Just to clarify, I'm the housing director for Salvation Army. My territory runs from just above La Crosse all the way to just below Superior. Currently in our shelter, and we are full, I have 7 persons who are above the age of 70 that would do well in Kitty Rhodes. I cannot place them. I have 8 developmentally disabled persons. I cannot place them. I have other clients within that resident, and these are not people from the Twin Cities or other counties. These are people from St. Croix County. I can't place them. It's a 2-year wait list for assisted living. Skilled nursing is on a priority list. If you are in an emergent situation, your advocate, your social worker at the hospital will call everywhere to try and place you within the county, but either someone has been discharged or they have passed. This is a situation we are in. We do not have enough housing for seniors so that they can age in place with dignity. As has been brought up, the cost of property taxes. When you get to that point, and we are still dealing with persons from the greatest generation as well as the baby boomers who are aging up, if they are only on Social Security with no other safety net, they cannot afford their homes any longer. And you can see this as you drive through communities in St. Croix County. Homes are slowly aging out just as their owners are because they cannot afford the basic maintenance. And then add the property tax on top of that, people are struggling. I have more people from the county coming in to the food shelf at Grace Place than I've ever had before. And I have more calls for assistance, not only to work on their homes, to find grants to help them, but just to pay their rent if they're in an apartment. And we do not have a lot of racks in St. Croix County that are open. They're not. So if the nursing home, in its grand history and in the wonderful way that it is profitable at this point in time and should continue to be profitable, if you look back in the history, there was an argument between New Richmond and Hudson when this was first proposed. Hudson wanted the nursing home. They wanted the insane asylum. It came to an agreement that the county seat would be Hudson. And let me not forget that Hammond was in that fight too. The county seat would be Hudson, New Richmond would have the insane asylum. And that's where we are today. So think long and hard, because it used to be that this county and this county board, its motto was service is our business. And if we are not serving the residents of St. Croix County as they age, if we are not serving the most vulnerable people, we're not doing our job. So let's get with it. Proposal B is very good. Revisiting it to make sure that we are staying on top of the financials is a wise decision. So let's continue forward with it, supporting each and every resident in this county. Thank you.
Thank you. Further public comment? Is there any further public comment? Any further public comment?
Hello, my name is Lisette Rendell. I am a nurse manager at Westfields Hospital. I'm here tonight representing not only Westfields, but the entire Health Partners organization. We are in support of the St. Croix County Health Center and it remaining a county facility. Since 2022, Health Partners has sent over 1,400 patient referrals to the health center, primarily to their transitional care units and their long-term care units. This averages to be about 43 referrals a month. Patients demand to go to the health center for care because of their long history of providing high-quality, compassionate care to their residents. They are an invaluable resource for people who do not have the ability to support their care in a private facility, for those who are too complex for private facilities, and those whose behaviors will not be supported at private facilities. The health center also supports 2 emergency placement rooms for those in need of a safe place to stay until other arrangements could be made. Those beds help to keep these people in a safe, compassionate place so they do not tie up the beds at the local hospitals or they do not get placed in other not ideal facilities. Health Partners has a long-standing, strong relationship with the St. Croix County Health Center. Their team always finds ways to say yes, and if they can't say yes, they assist us with finding other alternative resources. We are very hopeful to see the grant funding for the Kitty Roads wing, as this level of care is a valuable piece and is drastically missing from not only our county but from the state. Resources in our community and most of the state would give anything to have this type of wing. We have patients in our hospital, we have had patients in our hospital who are in need of this type of facility for over 100 days because of the type of secure and complex care that is needed. It's a very specialized care that we are not equipped to handle in a hospital setting. To lose our county facility would be detrimental to our community members and to healthcare in this county. Affordable, high-quality care is what the St. Croix Health Center is known for and should continue to be known for. They work really hard to find ways to care for the residents that private facilities just will not care for. Let's continue to support the St. Croix County Health Center and continue to make it a leading facility, not only in the county, but in the state. Thank you.
Thank you. Is there any further public comment? Is there any further public comment? Ma'am.
There is, thank you.
You're welcome.
Peg Audley, Town of St. Joseph. So the good news here is, what I've heard all night is we have a really nice facility here in St. Croix County. And also, on top of that, the financial picture looks pretty good. You know, we've got 11 years left on this bond, and then there's going to be some revenue coming in that will help the rest of the county. I take a little challenge to Chair Long that that we started talking about possibly selling this nursing home when that was never on the board, on your mind. Option C was there. And I do believe, even though it's not mandated, that this county expects more. We expect more than the bare minimum of what's mandated from every county. We want more. We live in a county that expects more. I'm just really encouraged that you're going to go with B, because what we did was we took this to the streets. We took this to the people so they could understand this was possibly on, as option C showed. It was on the chopping block. I will let you know that I've lived here 35 years, I've never seen an issue that has really bound this community together in a very divisive time in our country. It didn't matter what your political lines were, if you were urban, if you were rural, everyone believes in having this. Everyone says, quote, why can't they understand this is where I want my tax dollars to go? I want this for my family. We've paid for it for generations. The cost is nothing compared to what we get back. These are common comments we got from over 2,000 people. We put a petition out on Facebook and paper. You will see parts of them around the room. I have every 2,000 people here for you to look at. I'm going to leave this for our county clerk. Yes, New Richmond had the most signatures, but who was number 2? Hudson. Hudson. Every community signed this. Every community, from farm to farm, coffee clubs, book clubs, everybody took these papers. They all believe in this. They all believe this is worth it, that we take care of our own. So, okay, option B, thank God, right, that we landed there. And I think it's fair. I wish it was a longer runway, because every 2 years, people are going to look at it and worry again. Oh, are they going to chop it off? Are we going to end it? So I'm hoping, as this goes forward, that you outline very carefully that what you're looking at is how much revenue can they pay towards the outstanding debt, not that you're going to take away the services. Thank you.
I do have a question for you, Peg, if I may. Are there signatures on your petition that are from residents who do not currently reside in St. Croix County?
It's less than 10%.
What's that?
Less than 10%. These are all county. And that's why I'm leaving it, so you can look at this.
Well, I just want to make sure that if there are any signatures from people that do not reside in St. Croix County, that they be eliminated before you turn over your petition for us. Thank you.
We can do that. And what's curious is we had, as you were saying, we had people that signed from out of state because they used to live here or they used to have a family member here. That's how strongly they feel about it. But I can absolutely take those out. You're still going to have close to 2. This is only 2.5 weeks. It's a big, it's a huge response.
Thank you. Further public comment? Former Supervisor?
Good evening, everyone. My name is Roy Schoberg. I'm a past county supervisor. I live at 1108 Vine Street in the city of Hudson. And first of all, politically, I'm proud that the Kitty Rhodes facility, she was a proud moderate Republican. I'm not a proud moderate Republican, as you all know, but I was thrilled that I heard word that the Kitty Rhodes facility is going to receive these funds and it will operate as intended. I sure wish she was still around. Are we okay? Okay. So I wish that she was still living so that she could experience what is about to come. The fact that it's going to be profitable is just an added blessing. Well, that whole nursing home isn't there to make money. I remember when I ran for a county supervisor position, I was mandated. There was rumor that at that time that the county might be selling the home. And every single one of my constituents in the city of Hudson said, no way, no way. And then myself, together with a couple other people that are here today, Chris Babbitt, we gathered together, and by a vote of 15-4, this county board borrowed $20 million at a little over 2% interest, and now we have a moneymaker for the county that might be paying as much as $1 million a year back to us. But let me just submit that this is not, everything the county does isn't a business, and it's not a business model. This is health care. Healthcare. So this is for your mom and dad and the type of staffing they get. And I don't care if it loses $50,000 or makes $50,000 a year. That really doesn't matter to me. What matters to me is that we have a service that the county provides that we're all proud of. So I just like that, the fact that even though it's not a mandated thing from the state, I felt that the citizens mandated it. And the citizens are your boss. And so if their citizens are telling you and they're the boss, I think that's a mandate too. So it just didn't come from the state. And who's the state? The state is all the taxpayers and all the constituents everywhere. Our own county told me, told the rest of the board, and the rest of the board complied 15-4, let's fund this nursing home and we'll make it work. I just wanted to make one other comment that was already addressed. And that is, somehow the word got out through social media, and I think we were shamed that something unexpected happened and people got concerned. I think whenever you bring up the subject of let's just study the nursing home. Well, what do you expect is going to happen other than people get nervous about this? What's the outcome? What do you mean study the nursing home? Why would you study the nursing home? It's doing fine. No one's called the question. So when the question is called, I think the natural outcome is just that there's going to be nervousness, and some people are going to jump to the conclusion that maybe it's going to be sold. And obviously it was one of the possibilities. So I feel sorry for the staff. I still feel sorry for you, Sandra, for having to defend your well-run entity. And I just hope that if this is ever reviewed again on an annual basis, it's only the amount of money that it makes. It's never going to be reviewed again whether a county should run and own this nursing home. Thank you.
Thank you, Mr. Schoberg. Let me just say, we've heard some very eloquent comments from a number of people on a number of topics that are key, and that's why we're here, is to have public comment. But we should also keep in mind, if some of the folks that have spoken have captured your thoughts, we've heard them. We don't have to be too repetitious. If there are comments you really would like to make, we welcome you to come to the podium. Please come to the podium. Not trying to cut anybody off, but if you can associate yourself with some of these eloquent comments that have already been made, that would be great. And we could move along to hear from as many people as we reasonably can. Thank you.
My name is
Pam Benson, and I live in Kinnickinnick Township, so I am a St. Croix County resident. My dad currently lives at the St. Croix Health Center. He receives excellent care. I don't think he'd be alive today if he was anywhere else. He's 101 years old. He's a World War II veteran. He was a Navy pilot. So I believe he deserves the best care. When he was 98, he started falling and he had some heart issues. Well, the cardiologist said he couldn't have any cardio rehab because his heart was 99% plugged. So at that time, he had been falling, and so I had went and gone and stayed with him at his house, which is actually in Lake Elmo. But I had to stay overnight with him because he was afraid of falling, because he had fallen at one time and stayed on the floor for about 12 to 14 hours. He had care staff coming in every day, and so, but that's his, he ended up, and so he didn't want to stay overnight anymore without someone being there. So I was there, and I had to come back to my house in Roberts and take care of my cat in my house too. So for 2 months I did that, but fortunately, when the time came, I was able to get him in to St. Croix Health Center. And I'm very grateful for that, and I'm very happy that the St. Croix Health Center has such excellent staff, because my dad is still alive. Even though the cardiologist said no cardio rehab, his heart is 99% plugged. So anyway, thank you for your time.
Thank you. Are there any further public comments?
Hi, everyone. My name's Heather Stoll. Hi, Sandy. I worked at the health center from 2001 to 2016, so 15 years. I started volunteering at 14 years old. I moved through the departments, activities, kitchen, cooking, CNA, and then I became a nurse. So I could tell you on and on about how great the health center is. That's where my passion for nursing started. That's why I am the way I am today. My mama, who's in the other room, has worked there for 50 years, and she's a big inspiration for why I do what I do and where I ended up in life. But what I really wanted to talk about with option B with the proposal is the Kitty Rhodes addition. So my current role, I actually went to Health Partners when my daughter was a baby. I wanted to be home with her more, so I went to Amory Behavioral Health. Some of you may be familiar. And when I went there 11 years ago, it was a Jerry Psych unit. So we did all dementia, aggressive dementia care. And about 5 or 6 years ago, we transitioned to general adult psych. So 18 years of age and up. And that did open a lot of opportunities for our community that weren't otherwise serviced. However, I will say when we quit doing Jerry Psych care, it did leave a big void in our community. So we no longer service those with dementia, with aggressive behaviors that other people have talked about that they can't manage in facilities, that they can't find housing for. And so in my mind, I just wanted to reassure everyone that I believe Kitty Rhodes will stay full. I think there's a huge need, especially with Amory closing to the Jerry population. I think it'll be profitable, extremely profitable. It'll be well managed. As far as staffing, I know that's been brought up a few times. And I can say, knowing the staff at the health center and knowing the people in healthcare, I think it'll be well staffed, well trained. I know some of you know that the motto for the health center is that we don't work in a facility, we work in our residents' home. It's a home. And I think Kitty Rhodes will become that for those members that are not served currently. So I just wanted to touch on that. Thank you, guys.
Thank you. Is there any further public comment? Any further public comment?
Hello, I'm Linda Carlson in Pleasant Valley, part of St. Croix County. I don't know a whole lot about the nursing home, but it sounds wonderful. But I'm here as a Christian and as a VA employee. I really love our elderly veterans. So I was happy to hear that Plan B. My second point is, as a taxpayer, I do care about our taxes. So happy to hear they're making a profit and putting money back into the pockets. And number 3, this is a hot topic, Medicare, Medicaid. A lot of baby boomers, a lot less people working. Is the money still going to be around? So might want to consider, like, when there was the talk during the national talk of grandfathering those people in, that's all they have to pay, and the working class, cut them off, make them get long-term insurance. I don't know what the answer would be when it comes up for review again. Thank you.
Thank you.
I am Mark Fanas in well, I live in Holton, but grew up in Somerset. My father and I built a 24-unit Section 8 housing for elderly back in 1977. What I found out is the people that needed additional, if they don't pass away at my place or go to a relative or hospice doesn't come in, the majority of them go to the health center in Richmond. And the reason for that is they're able to afford and get in there. I think that's what we're looking at. You know, we're from a lot of small towns around here. We built that place in Somerset to house our relatives and our friends. People in Somerset, the farmers out in the community, did not want to go to Stillwater to an elderly facility. All of us want to stay in our own little communities, and that's why we have these 7 Section 8 housing facilities all around our county. I agree that we need to stay on top of the finances, I think, but we need to not talk about closure. We need to talk about how it works. And right now, we have a beautiful facility there. I congratulate the board back in 2014 to make it that step forward so that we can say that and provide the services we have. So thank you for considering this, moving it forward, and not talking about closing.
Thank you. I think we have one more public comment.
Chris Libby, St. Joe Township. I talked before about my concerns regarding keeping the nursing home as a part of our county facilities. I listened tonight with great interest to a lot of the other comments, including and specifically the comments from the staff person from Westfields. It's incredible to me that there's such a huge struggle trying to find a place to send people to. And I think that we need to be thinking about that. The other thing I noted, I looked at some data that was provided to me that showed about 7.3% of the county population currently is on Medicaid. That's a huge number. And I suspect that's going to grow. So I think that concludes my comments. Thank you.
Thank you.
I know everybody's hungry, but it is a public meeting. So my name is Lisa Leahy, and I am the Director of Social Services at the St. Croix Health Center, and I have been there 43 years. I've seen a lot. I've been through a lot. I've heard a lot. But we run a good ship. We have a great team. We are working under one of the best administrators ever. And we have a great administrative team, and we have a great nursing team. I'm asking that you guys come and visit our facility. Many of you that I see here, I have never seen at the facility. I have never seen you. I know Dan and Dave have been there almost every week. They come up and see us. And I really ask you to come up. I want you to see the sense of belonging that our facility has, the sense of family, the sense of support that they have for one another. It goes all the way from the housekeepers to the laundry to facilities who even stop in and joke with the residents. The nursing assistants, activities, dietary, finance. Everybody takes a deep interest in our residents. They are our family. and they are treated like our family. I do have the saying on my door that says our residents don't live in a facility. We work in their home, and that's something that we truly believe in. I want you please to stop in. I think that we run a really good ship, and I think you'll get to know us better and understand why we believe we need to be there. Thank you.
And I tagged along with Lisa. My name is Tamara Turner. I'm a nurse supervisor at St. Croix County Health and Rehab, and that's something that I say very proudly. I want to actually recite a few words that were given by Ken Witt, which I really think strike close to home. We're a service-driven organization. We serve this community. It's about the public that we're serving. That's what we're about. Our mission statement says, we will strengthen our social and economic future by providing health, safety, and the well-being for all. That's what we're about. It's for everyone. And when we're talking about the elderly population, I know that that is a number that we do serve. But I also want you to know that we do serve others, others that have maybe terminal illness, people that are on hospice. We take great pride in the care that we provide. So when we're talking about the elderly population, I just want you to know that this includes hospice people. This includes people that are not maybe the elderly. We do service those people in our community, and I think it's very important that we continue to do so. And Sandy, thank you. Thank you for hiring me. Thank you for giving me the opportunity. I love my job and I love what I do.
We've heard some very eloquent comments tonight, and particularly about the health campus and the people that run it. If there are no more public comments, there may be one more public comment.
I don't need to repeat all the good things everybody said, because I've had two experiences. One for my dad when he was dying. I had to move him from a private facility to here. I didn't know anything about it at the time. I just got lucky. Then when the old man I'd been married to for 61 years slipped and fell a year ago, broke his hip and wrist, we got great care at Lakeview, lucked out again. Then when they said, you got to get out of here, I didn't know what to do. And she said, well, we do have a bed for you in New Richmond. And I thought, oh, the county farm? Okay. Well, we lucked out again. I was there every day for the 3 weeks of his rehab, so I know what they do there. I wasn't there to inspect. I was there to make sure that he did all his therapy correctly, because I knew he wouldn't do it with me at home. And so I'm just grateful that it's there, and I thank you all for considering it. I know you are charged with making sure that this county stays solvent, but also, as it says here, you reveal the values and priorities by your decisions, and you have made a good decision. And the last note is, I want to have my name on the list for Kitty Rhodes.
Thank you. We've checked with the overflow rooms. I don't think there's anybody there that wants to come forward, so I think we've exhausted public comment at this point. I want to thank all the audience for coming in, all over the building, and particularly those who gave very heartfelt, very knowledgeable, thoughtful comments during the public comment period. And with that, public comment will end, and we'll go to the request for future agenda items. Are there any? Seeing none, we'll go to announcements. Gotta be faster, Burning. Let's go.
All right, Mr. Chair, thank you. So I actually will go with some of the supervisors that brought up the point of looking at all enterprise funds, all non-mandated services at the next committee of the whole. I think we should do that. So I would ask that that be done.
Any other future agenda item comments? Okay, we'll go to Supervisor Swanepoel for an announcement.
I just wanted to say that Henry Hirchin was a Emerald's Town Board Chairman for, I think, the last 40 years, and he just passed away They're having a visitation from 1 to 7 over at the Baldwin Legion. I'd like you to keep his family in your thoughts and prayers. Thank you.
Oh, boy.
Thank you.
Thank you, Supervisor Swanepoel. Supervisor Burning.
It's a proud dad moment announcement. My son, who we just dropped off at Madison, made the marching band as a freshman, and there were only 2 out of like 20 some that were picked to be. So I was very, very happy. I'll be, guess, going down to Badger games. So.
Congratulations. Any further announcements? Seeing none, the date of our next meeting is October 1st. Now, that's also the date of our next, of our second from now, board meeting. So we'll be doing a committee of the whole meeting at 3 p.m. and a board meeting at 5 p.m. so that, pardon? Now, double header. Now, given that Supervisor Burning had a request for looking at certain items, and that COTW was to focus on the budget, maybe I could ask, we could work together and see if we could address those items, but maybe that might not be the best item to address all of them. Yes. Okay, great. Okay, any other comments from anybody? With that, we're adjourned. Thank you.